it started with the bishop signing, we confess our sins of negligence and carelessness. We didn't know our children are being destroyed. Then they now say what they want to do.
We do programs to go to churches, to Christians, not only to pray in the pulpit, to teach there. Most of the clergy are motivated by our programs. And now they understood drugs is not a part of an ointment, drug is a disease.
Kama una afya mzuri, utajenga nchi yako. Sababu utafanya kazi, utakwenda shamba, utakwenda ofisini, utakwenda kwa serikali ufanye kazi. Lakini kama umejimaliza na ulevi, uwe Muislamu au Mkristo, hata ibada itakushinda. So nakuta ulevi imetiwa katika kipengele na Uislamu kama ni chanzo cha kurudisha nyuma maendeleo ya kiafya, kijamii na taifa zima.
There's no country in the world that survives without a rigid Alcoholic Drinks Control Act. There's none.
Alcohol and drug abuse is a growing phenomenon among the youth, young adults and women. These groups are vital in the productivity and development of a nation. Statistics show that the burden of substance use disorders in sub-Saharan Africa has been projected to increase by an estimated 130% by 2050. Abuse of alcohol and drugs has various socio-economic effects to the users. Critically, it leads to serious mental health issues such as depression, developmental lags, apathy, withdrawal, and other psychosocial dysfunctions. Substance-abusing youth are at higher risk than non-users for mental health problems including depression, conduct problems, personality disorders, suicidal thoughts, attempted suicide, and suicide. Alcohol and drug abuse poses a major problem affecting the socio-economic development of a country.
Look at agriculture. There are 4 factors of production. 4. One is land, labor, capital, entrepreneurship, or management. So, with alcohol, land is there, but soon goes. To brought maguta maguta. That's a popular thing with the Kikuyus. They sell everything to be plots. Yeah? Labor is not there. Today, where you used to hire 1 man, you need 9 men. So they become even a liability. So people have resorted into some improvised approaches. For instance, you'll be surprised, they use chemicals to wind. Use of chemicals has its own serious disadvantages. So instead of having 1 man do, say, an acre, you have 9 men to do an acre or to do a harvesting. There is no labor.
In Kenya, it is estimated that more than half of drug users are aged between 10 to 19 years, with commonly abused drugs being alcohol, cannabis, glue, and psychotropic substances. According to a 2017 survey conducted by NACADA, nearly 12.2% of persons aged between 15 to 65 years, an estimate of 3.3 million Kenyans, actively use alcohol, while 10.4% are addicts. This survey further indicates that 8.5% of the population, which is 2.2 million people, use tobacco, and bang users at 1%, making 270,000 persons. Kenya has been recognized as a transit country for cocaine and heroin due to its strategic position, resulting to an upsurge of injecting drug users within the country.
The elderly man is Scottish. and he's now very old. He said, and I did not know, but they knew. He said, Kenya one day, if it is not washed, if measures are not put in place to control and manage the trafficking, the movement of drugs, said to come from wherever they come from, pass through Kenya to go to the market, they will remain in the country. Because today they said Kenya thinks that it has given away for drugs to pass, to go to other countries. And they benefit by those who sleep in the hotels, organizing how they'll travel to the other destination. One day there will be no destination, but you'll add with them. These people will be London, which is now true.
Inaochangia sana hapa pwani vijana wengi kujiingiza kwa mihadharati aina mbalimbali. Kwanza ni availability. Inafanya vijana wengi wanaipata kwa rahisi na kujiingiza. Sababu ya kwanza. Sababu ya pili, pia pressure ile. Unakuta kwamba vijana wanaposhikana basi ni rahisi kwa vijana kuingia kwa mitego kama hii.
Isiolo is the gateway to northern Kenya, and this county really is the transit route of drugs and substance that come from our neighboring country. They pass through our neighboring county, Marsabit, and there's around 3 routes that are being used by the drug fellows.
It is because of the growing concern on the extent of drug use in the country that the National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, was established.
Moi also was frustrated by somebody who had taken alcohol, and he wanted him to be helped, the family to be helped. So Moi said, Kagudi itaku appoint. He appointed Kagudi, and Kagudi was told to clear alcohol from the estates in Nairobi, not beyond that. That's the time when Kagudi was appointed, being an administrator. He knew more than me because he was a PC. We joined together and we started working.
The executive authority of government at Article 23 that time, they were called section 23 of that constitution, vested the executive authority with the president, and it stated who shall exercise that authority directly or through officers subordinate to him. I had retired in 1999, having served as within the public sector, heading up the top 2 was Provincial Commissioner Nyanza in Nairobi, and then Permanent Secretary and Director of Personnel Management in the Office of the President. That's the scenario. So the President makes an announcement, and it is stated from how it came in the media, the President has created the Office of the National Coordinator to campaign against drug and substance abuse in schools, other learning institutions, and on the street. He has appointed Joseph Kagudi to be the National Coordinator. I knew it is a complex threat to the country. I just went to Harambe House, head of public service. So when I go to the head of public service now, and she tells me, I just asked her, is am I relevant to the announcement yesterday? What you do, I am not aware. I'm not briefed. The president is in his office. Why don't you go there? She buzzes the president, and I go in. He comes to sit on the lounge. So he told me that more or less that he's concerned because the foundation of the country is getting destroyed by the youth involvement in drugs and substance of abuse. You know, that one is very clear. You can see what he has identified. So I waited now for instructions how to. He just looked at it, he just said, go see what others are doing. So I closed my notebook, put it in the pocket as usual. So I left. I knew I am on my own. I knew there is no section or paper that I referred to. I knew there is no single law that is going to guide this. So, with the kind of exposure that I had in government, I decided what to do. The first thing is to get views. I've never, normally I'm the person who challenges professors, because I tell them we pay you to think. So they are the first lot that I approach. So I go to my old notebook, all my contacts. Professor so and so, you have heard what the president said? Yes, that thing is so serious. Then they talk. They talk. Finally, and for me, I just want to know what is the scope of the problem. If nothing is done, what is going to happen in the country? And 3, what is it that must be done? Those are in my questioning. That's right. Or retired officers, colleagues that I worked with, politicians, within my scope of contacts. Every one of them, I was ending up with a very specific request. Saidia mimi to know my feet. Give me a page or 2 or A4 as with the 3 things. What is the scope of the problem from where you stand? 2, if it's not addressed, number 2, what is the long-term implications to the country and ramifications? And 3, in your view, what must I do? They brought them. Go to NACADA, you'll get volume 1, volume 2, and volume 3 of those 3 answers to the 3 questions. And that's when I knew drugs and substance abuse is like, how do I describe it? It's like the bride and the elephant. Everybody sees it where they are. So when they came, I knew it is a complex threat to the country. And when the threat is of this magnitude, very complicated, what you do is that I decided burn it to its smallest unit. If you burn it to the smallest unit, you are therefore able to see it. And if you deal with it from that very small unit, then you command it. That's exactly what I did. So I knew then the kind of campaign I'm going to mount will have to take a format that I create.
What we did is, again, with Mr. Kaguthi then, and of course later Mrs. Jennifer Kimani, who took over from Mr. Kaguthi, we worked with various stakeholders on reviewing the context that we had in the country. Actually, before we worked on the bill, we actually had a draft policy. In fact, the alcoholic drinks control policy is what gave the rise to the alcoholic drink control bill. So the policy looked at the wider perspective and legislative and policy interventions that would control alcoholic drinks. At that particular point, the government was alarmed by the high rate of alcoholic drinks consumption, deaths and disabilities, the number of young people who are consuming alcohol. So it was obvious that the Liquor Licensing Act, as it was, because it was just seeking to control licensing, was not sufficient to deal with control of alcoholic drinks. So that's not the reason why, beside now doing the policy, we started having a public conversation, both with the legislators, Ministry of Health, the Kenya Reform Commission, and other stakeholders. And of course then, because NACADA was within the office of the president. We would have meetings with the provincial commissioners, district commissioners, and police commanders to discuss about what needs to be done.
The National Authority for the Campaign Against Alcohol and Drug Abuse adopted the 2018 overarching policy. This policy provides a framework for sustainable, multi-sectoral and balanced approach in addressing alcohol and drugs abuse to protect the health, safety and well-being of the Kenyan population. The policy aims at promoting harmony, coordination, as well as providing clear approaches in managing alcohol and drug abuse.
There's no country in the world that survives without a rigid Alcoholic Drinks Control Act. There's none. So in Kenya, there was none. The first attempt was 1902. 1902, there was a problem at Murang'a, and they started to do something. They didn't succeed, but at the time when they set up the first legislative council, that was 1907, on the 17th of August, around 2 p.m., when they had the first Regico Assembly, governor being the speaker, and another 5-6 members. There were only 2 bills to be discussed. The very first ones on African soil. Number 1 was to stop slave trade. Number 2 was, and still remains, control of alcoholic drinks. So you realize over 100 years, this was a problem. But it took 103 years to have a comprehensive law that would put on board, would consider everything that comes to that industry. There were several pieces of legislation in between, like Prohibition of Changa Act, African Drinks Control Act, and so forth and so on, but none as comprehensive as the one we did. I made the bill, a humble 8.3 million that particular time, and it was received very well across the world. We did go to make a presentation with the then CEO NACADA, Jennifer Kimani, and the late Honorable Ojonde went to Ukraine, and there was a big seminar, and professors from all over the world showed up. I made a presentation, and they gave me thumbs up that particular time. So I was so sure by the time I was coming to the floor of the house that I was going to succeed, and truly we did succeed. And on the 13th of August, 2010, the law was enacted. That's the Mutuzo laws.
Honorable John Mutuzo, again, just like Honorable Golsungu, had a passion to make intervention. He being an MP from Naivasha. Naivasha is highly affected by traditional drinks and some of them illicit drinks. So he also had a passion to regulate and control alcoholic drinks. And he had participated in the meetings that we were facilitating for legislators on controlling alcoholic drinks. So what he did is that he had also, because we used to share public documents like the policy, so he had the passion and he got the commitment to introduce a bill in Parliament. So what we did as NACADA was to provide support. So Honorable Mutuzo tabled the bill, a draft bill, to Parliament. We then provided support to the bill, making further input, doing further changes, facilitating stakeholder engagement and consultations. So that's the main role that NACADA played. At that particular point, I was supporting NACADA as a consultant, the technical advisor. So my main role was to review the drafts, so engage with parliamentary staff, review the draft bills, engage high-level policymakers until we got a framework. And of course, we also worked with the State Law Office or the Attorney General Office. And finally, we worked with the parliamentary committees. We engaged the committees, provided research materials, policy analysis, and of course, providing specific support to Honorable Mutuzo. So that's just a summary of how then the bill came in place.
The National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, is a state corporation established through an Act of Parliament in 2012, Cap 121B, under the Ministry of Interior and Coordination of National Government.
The current form of the authorities, that is a statutory body established under the National authorities for the campaign against alcohol and drug abuse act of 2012. So from that time, we can now say that this is an authority that is anchored in law and clearly allocated clear functions that are articulated in the act that I've just mentioned.
NACADA's history dates back to 1996, when an Interministerial Drugs Coordinating Committee, IDCC, was established through Gazette Notice number 4048 of 12th July 1996 by the Office of the President. At a later date in 2001, the National Agency for Campaign Against Alcohol and Drug Abuse, NACADA, the precursor of the current NACADA, was established.
We had developed the name NACADA with the 2 A's. Then we reduced that to 1 A. We started going round, but many people were negative about it. I remember the minister who was in charge there, we were given 40 million from Treasury by the Minister of Internal Security. He gave us 20 million to run NACADA, and we were given 40 million. Kagudi said, what are we going to do with this? Can we travel? There were no vehicles. We kept on borrowing, and once we borrow and repairing vehicles from other ministries to enable us to travel. We went round. We were joined by Gatere. Dr. Gatere, late Dr. Gatere said, I'll be with you. I'll work with you. We worked. Because I was motivated, highly motivated to learn about these substances. And now I knew, and I could go through literature. Finally, we formed NACADA. And being in NACADA, when it developed and got a name, so many people were interested.
Its mission at the time was to create awareness and educate young people to abstain from use of narcotics and refrain from taking alcohol. Nonetheless, NACADA's overall mandate is to coordinate a multi-sectoral campaign to prevent, control, and mitigate alcohol and drug abuse in Kenya.
The authority draws its mandate from 2 legal frameworks. NACADA Act creates the authority. And because of the nature of alcohol abuse in the country, as I will later mention, alcohol is the biggest challenge the country is facing, alcohol abuse. And therefore in 2010 a law was enacted in Parliament that is called the Alcoholic Drinks Control Act. Under this act, really the object of that act was to ensure that whatever alcohol there is in the market is safe for human consumption. And the agitation for this law arose from incidences of drug-related death and harm. And therefore the law actually seeks to regulate the alcohol industry by putting in place controls around what is safe and what are the allowed, constituent of alcohol. It also regulates where it should be licensed, and it creates mechanism for licensing. And the law also kind of determines the hours for selling alcohol and when you should close. So the law is actually implemented by NACADA, but it is dedicated to controls around the abuse of alcohol in the country.
NACADA has 9 regional offices, which include Nairobi, Eastern, Western, Central, Nyanza, Coast, North Rift, South Rift, and Northeastern.
As NACADA in the Western region, we have quite a number of programs. I remember last year we had programs that were touching the institutions, the learning institution, basic learning institutions. That includes the TVET institutions. We still have them this year. We also had programs for youth out of school. When you talk about youth out of school, we're talking about this group that is not employed. Maybe they are finished college or they are finished Form 4 and they are not anywhere. You see, and they are a vulnerable group because of the frustrations that come in when you're not in school and you're not at work. It becomes an opportunity for people to use drugs or to even to be used to sell, because that time you're looking for money. And I remember last year we reached over 900 youth out of school, and we targeted them in their sporting events, and we were able to talk to them about drugs, how they could prevent. Mostly we're talking about if we can be able to prevent start or at least delay, we buy time so that these people can mature. These people can deal with their emotional state. You know, when there are years that are very emotional, especially when we are teenagers, and anything that comes, we easily take it in. And we believe anyone. Anybody who comes with a story to tell us this is good, we are easily influenced at that stage. So we are doing a lot of preventive programs, not just among the youth out of school, but we're also going to schools. We're going to the secondary schools and we're talking to them.
I coordinate our programs in Central Region, which comprises of 5 counties. We profile areas where we have many cases of illicit brews and substances of abuse. And we have a kikao, or a sit down with the community. And we talk them through the problem, and we help them to discover or come up with solutions to their own problems. On this one, I would like to cite a very successful session we had somewhere in Muranga, in Kiharu, where there was an uproar of the increase of bangi, and the peddlers were even destroying children as young as 6 years. That is for class 1, 2, and 3. They were using them to peddle within the community. And we had a forum where we interacted with the community and we came up with the resolution. One, remember, issues of alcohol and drug abuse also has a correlation with security. So we realized the problem was that the community there, they were fearing to report the peddlers within themselves. And when we sat them down and made them realize that if they don't report, it is the same community which is getting destroyed. They came up with a resolution that they will not hide or shy away from reporting such culprits. And actually, out of that sitting, we came up with a list of the peddlers which were shared with the security officers, and within 1 week there was a crackdown. Then they made a resolution that they will not allow anybody else involved in those to live within the community. So in case you are doing that, you are banished. And 3-4 months down the line, we are happy that now the community would say it's clean of those.
We have programs for women. We have programs for parents. We have programs for school-going children. We have programs for youth out of schools. And we have programs also for public sector institutions. And that also includes TVET, universities and other colleges. That's what we actually majorly do. We also coordinate crackdown on illicit alcohol and illicit drugs. And of particular attention is actually cannabis, which most people know as bangi. We've been having problems with the bangi that comes from Shashamane in Ethiopia.
These regional offices work closely with the National Government Administration Officers, NGAO, to campaign against alcohol and drug abuse within the unique respective areas.
NGAO is a department in the Ministry of Interior, and one of our performance indicators is to fight drug and substance abuse. So we have to work with NACADA because NACADA brings in other players, like the anti-counterfeit, the issue of those people that are not paying their revenue, so they bring in KRA. So it's able to bring the other players on board, so that GAO, the police, and NACADA are able to work together. So what we do, we carry a number of crackdowns right from the village level. We involve the assistant chiefs, we come to the location, involve the chiefs, and it's a continuous crackdown. But maybe the unfortunate bit is that we are only dealing with reducing the consumption, but you're not really dealing with where it is brewed and the standards. So sometimes we make a lot of good gains, and sometimes we make a lot of losses because we fight one route because NACADA is not consistently on the ground. Maybe I don't know whether it's the issues of funding, so they are here today when they're very responsive but not consistent on the ground because of the issues of funding. So we've been working very closely with NACADA.
National administration plays a coordinating role. It coordinates all government agencies in the field, and NACADA, being one of them, benefits from that coordination.
We have a multi-agency unit at Archer's Post, which involves NACADA, DCI officers, KRA, CAPES, all the officers that constitute the multi-agency, to ensure that we nab and arrest fellows that pass through there or drugs that pass through there. We have a unit, a special unit also, which specifically coordinated by NACADA and our team to arrest. We also have a sniffer dog there that we use to arrest these drug traffickers. And we have really done a great job. In the last 1 year I've been here, we have arrested several officers, even government officers also involved in the drug business, and also other Kenyans.
Porous borders, lack of common policy to govern narcotic substances within East Africa community, traffickers coming up with different channels to evade roadblocks, and inadequate coordination among key players, among others, are the challenges facing the campaign against alcohol and drug abuse.
What you realize is that most of our borders are not properly manned, that I have to admit. And from Ethiopia, we have a lot of porous borders that people can access our country even through the bush. We have identified over 56 routes, trafficking routes for cannabis from Shashamane to Kenya. But of particular mention is from Shashamane, Ethiopia, to Marsabit, to Isiolo, to Meru, all through Nanyuki, Nairobi, to Mombasa. And because of that, we've been having various programs, especially in Isiolo, Meru, and Marsabit. We've also brought in other regions, our neighboring regions like Northeastern, because it's also part of the route. We've also brought in Mombasa because it appeared to be the destination.
When it comes to issues of substance use, they are evolving, they are dynamic, yes. So we have new emerging trends, new emerging drugs, and so even the law will need to keep changing with the changing times. We didn't have any legislation about shisha, miraa. These are emerging drugs that are not addressed in our current laws. And so the law, the legislations and the laws have to evolve with the emerging trends that are coming up.
Contrary to what people know as substance of abuse, we have so many new substances that are being abused by especially the young people that we didn't know before, but we now know they exist. And the biggest challenge is around prescription drugs, which are the most abused especially by young people.
NACADA works closely with schools, institutions of higher learning, workplaces, county governments, ministries, parastatals, national government administration offices, community-based organizations, CBOs, non-governmental organizations, NGOs, self-help groups, faith-based organizations, in addition to individuals working towards ridding the society of the menace of alcohol and drugs.
NACADA has a program where we are targeting primary school pupils so that we create awareness at that young age of the dangers of alcohol and substances. And in that we have a program we call Life Skills Training, which is targeting class 5 pupils to inculcate in them life skills, which will help them to make informed decisions so that they can avoid the influence of using substances. Why we are targeting class 5 pupils is because that's the age when between 12, 13 it becomes the experimental stage as they grow, and that's the time they try to experiment some of these substances. And going from the feedback we have been receiving, that is very, very effective, in the sense that teachers in those or teachers who are dealing with those people have seen remarkable improvement in academic performance and discipline among those people who have gone through that program.
Implementing the life skill program for me has been one of the greatest milestones. I have gone to a school to undertake monitoring, and you get very good feedback from the head teachers, whereby they are telling you now our children have better communication skills. You know, they are able to solve problems better, they are able to socialize better. Because life skill is basically about, you know, empowering the child with skills on how to handle the problems they encounter. And one of the problems they will encounter is substance use.
NACADA comprises a board of directors, provided under NACADA Act of 2012, which is made up of expert individuals with key competencies representing strategic line ministries. Others representing special interest groups are also incorporated to promote diversity of thought and ideas in strategic policy formulation in dealing with alcohol and drug abuse in the country.
We work very well with the management team. We have an excellent management team that is very hardworking and forthright. And the laws that are there, we also assess them. If there are any that need to be re-looked at, we do advise through the proper parliamentary committee that is concerned with us, and we do it very well. And the direction that I'm very happy about that we have taken is the one that I've already talked about, the setting up of rehab centers, which can now take care of Kenyans, so that now we can reduce on the incarceration, and the Kenyans can now go for counseling and rehabilitation.
Day-to-day management affairs of the authority and programs are vested in the office of the Chief Executive Officer.
We have seen a lot of progress in terms of the public sector institutions implementing specific programs, prevention programs, and some of them are able to allow the employees who are affected access rehabilitation services. The other thing that I would like to mention is the issue of various surveys that we have actually conducted that have helped us to design specific programs to respond to the findings from these surveys. We did another survey around the issues of emerging substances of abuse in the country, and the findings were shocking because contrary to what people know as substances of abuse, we have so many new substances that are being abused by especially the young people.
NACADA also assists and supports the county governments in developing and implementing policies, laws, plans of action and control of alcohol and drug abuse.
NACADA has taken its rightful place as a national focal point on issues of alcohol and drugs. Remember, Kenya, we have two tiers of government. We have the national government and the county governments. So the authority now coordinates interventions for those two levels of government, ensuring that we have a very active involvement from non-state actors, churches, and people who are also affected by drugs. So the authority has developed quite a number of guidelines to support different stakeholders in implementing interventions related to prevention of alcohol and drug abuse, treatment for people with substance use disorders, as well as the issues of compliance and ensuring the implementation of national laws for alcohol and drug control.
At the same time, the other policy direction that we have taken is to engage governors also, so that now the governors, are the ones who do the registering of bars. And we are working on the governors so that they can have a change of mindset, so that now they realize that they should not just increase the number of bars. They should follow the law. The law stipulates where the bars should be placed and the distance.
Over the years, there are key milestones that the authority has achieved.
NACADA has done very well, over 90%. Everybody knows alcohol is bad. We used to have T-shirts, we used to have seminars, we could arrange for convoys bigger than the ones we have been doing on the campaigns, do real campaigns, inspectorates, and so forth. And we're going now to phase 2, where we're going to have the state-of-the-art laboratory so that when you say alcohol is bad, you're able to do ABCD.
Over the years, there are key milestones that the authority has achieved, and a few of these include the process of establishing the country's first government-owned Center of Excellence in Treatment and Rehabilitation at Miritini in Mombasa County, accreditation of more than 100 rehabilitation centers, mounting of tens of life skills training programs, as well as carrying out multi-sectoral-led crackdowns and other enforcement activities.
Miritini was a former NYS substation which housed so many NYS men. So when the president was in Mombasa sometime in 2015, he directed that this facility be converted into a rehabilitation center to address the challenges raised by leaders from the region. I think we have a big dream. We have done a master plan, but as we are talking now, we have about 250 patients who come and go, and around 45 inpatients who are undergoing treatment. And we have a concept which is actually holistic management of addiction. And we are hopeful that the people who will go through our rehab, they go through the comprehensive package where they will come in for screening, go into counseling, go into either individual or group counseling. Then when they stabilize, we want to engage them with activities within the compound. And finally, when we are sure they can now be able to take livelihood skills, we are actually finalizing a workshop in Miritini, which would be offering that skills development kind of thing. I therefore see that as one of the very successful achievements.
The Narcotics, Drugs and Psychotropic Substances Control Act was gazetted in March 7, 2022, setting the scene for the implementation of the law. The law provides a structure for combating the abuse of narcotics, drugs and psychotropic substances by prescribing several penalties.
When a person is brought in court, we look at the law under which this person has been charged. So the main act that governs this is the Narcotic Drugs and Psychotropic Substances Control Act. So you look at what the law says. If there is sufficient evidence, you get back to the law and say, what penalty does the law prescribe? So if the law says a minimum of 250,000, in most cases that is what you'll give.
NACADA has undertaken various interventions in an effort to address alcohol and drug abuse in the country. These interventions have largely focused on demand reduction and supply suppression, which involves formulating strategies to control the production, trafficking and sale of alcohol and drugs.
One, and which is very, very popular, is supply suppression. Police, or like they're doing in Nairobi now today, a whole battalion of people working from bar to bar, you can supply with that. Nobody succeeds in the world. Both drugs and alcohol, nobody succeeds. The best way to do it is demand reduction. That is the second option that you have. Targeting the potential consumers, treating them, and then carrying on with advocacy. I'm involved in the treatment and rehabilitation, but you need advocacy so that you don't get there.
The authority has collaborated with various stakeholders, beneficiaries and development partners who continue to support various aspects associated with the campaign against alcohol and drug abuse in the country. Aside from that, NACADA leverages on existing legislation to effectively deal with the complexity of drug problem through National Technical Committee (NTC) established by the government in 2011. The implementation of Narcotics, Drugs and Psychotropic Substances Control Act of 2022 requires active involvement, commitment of resources and action by all stakeholders.
We have not seen many of the counties take up this challenge. of drug control, which is a dual function. If you look at the Constitution Schedule 4, you will see drug control there, and you will see the licensing. Licensing is actually a very powerful tool for control. So what we are saying is, can there be a system where you can say enough is enough? And we are encouraging those responsible for licensing to also bring on board public participation, so that people will decide whether they want more bars or they want less of bars. I think that is an important issue that we want to engage the counties to adopt. So we need to have more county governments come up, ring-fence resources, invest in prevention education, awareness creation and advocacy, and more importantly, those who are affected, let them do rehabs for them.